use for your hair patient.
Finasteride is the most popular and, as practice shows, effective hair treatment, but only when it can really help and it makes sense. Not when you've seen some video and decided to take it, not when some internet forum just showed you results after using it, and not when a clinic consultant recommends finasteride without any knowledge, because this will also give the clinic a better chance of having an effective result for its portfolio during 1 year only. And some consultants recommend to use it for 5 to 6 months, which in itself contradicts the principle of finasteride work.
Now I act as a Thai president of Thai Society of Hair Restoration Surgery.
In the following videos, I'm going to talk about the difference between finasteride and dutasteride, topical and oral minoxidil, and tell you about the cases of my guys who are under my care. Also talk about what a strategic plan is and why it's extremely important in hair treatment. I'll also record a video about side effects and placebos. And today we're going to talk about topical and oral finasteride and ways to reduce side effects from finasteride. Please don't forget to subscribe to the channel and share the video. If you have any questions, you can ask directly in the comments under the video. Within the first hour after the video is released, I actively answer all questions that come in the comments.
Finasteride is the main medication that acts to stop 5-alpha reductase enzyme. That is the key main enzyme that changes testosterone to dihydrotestosterone. That dihydrotestosterone will inhibit hair growth. It can cause miniaturization of the hair. So finasteride can block this process. And we have two preparations, 1 milligram and 5 milligram. In Thailand, you can use both. But if you use 5 milligram and divide it into 4 parts, it will be a little bit cheaper. This is an example of before and after using oral finasteride for at least 1 year.
Everything looks super good in the picture, and it seems like the person had nothing at all and came from nothing. Not really. Remember that finasteride needs material, hair that can still be treated and has something to recover.
We have meta-analysis about finasteride. The finasteride have effect we call the dose dependent. If you use more, like a 5 milligram, it has more efficacy compared to 1 milligram and 0.2 milligram. But the side effect also have increased a little bit more.
Here we have the total and final figures by the 24th and 48th week, corresponding to 6 and 12 months. Note also that the placebo value is higher than some of the minoxidil effect values. Later, there will be a separate video about minoxidil. Note also that dutasteride 0.1 mg is almost 10% more effective than finasteride 1 mg.
Half-life for finasteride is like very shorter than dutasteride. The newer generation is about 4.7 to 7 hours. So if you would like to let the patient to have blood donation, you have need to stop finasteride for at least 1 month. Side effect is also the major concern for the patient. Some patients thinking that if they have loss of libido, better for alopecia. So it is the main side effect, and how we can decrease or avoid this side effect. The side effect, we switch to think about the topical finasteride, but the topical finasteride have some problem because of the molecule have very poorly penetration through the sternum cornea because of lipid barrier. So how we use the topical finasteride? We have strategy by changing the solvent, small particle, and use the enhancer for topical finasteride. First, for concentration of topical finasteride, we use from 0.005 natural 5% solution to 1% gel. So many preparation. I will show you the result, the difference of each concentration.
Those who crumble a tablet at home, mix it with water and apply it with a sprayer or other method, depending on the individual. This can have an amplitude of effectiveness from below average to zero effect. But such a placebo effect.
Because of finasteride have low water soluble, so you must use 40% water, 60% ethanol for being the solvent for finasteride gel. And for solution, sometimes you can add some chitosan. This is to act as a solvent for finasteride solution. The other way that you can use finasteride by using technology called the nanoparticle, polymeric nanoparticle.
Polymeric nanoparticles, ethosomes, and fullerenes. They can potentially improve drug penetration, enhance efficacy, and reduce systemic side effects. Simply speaking, through such approaches, it is possible not only to minimize side effects, but also to equip the shampoo with the ability to not only wash out the hair, but you could say naturally treat the hair with finasteride. And there are such shampoos. They are produced in Taiwan, Turkey, and India. Why these countries? The laws and the regulators. Because in many countries, finasteride is available by prescription only.
You can use like a soya phosphatidylcholine enhancer for this ethiosome nanoparticle. The last thing that you can use to produce the topical finasteride is that you can use the enhancer. The enhancer, like a transcutal, can add to increase the absorption for finasteride. And this is a picture when you add chitosan for this patient. The other thing you can use like a microneedling finasteride. This is a new technology that you put like a small needle and it will penetrate and let the drug delivery through the skin. The efficacy, when we see, we would like to know whether if we change from oral to topical, whether it's good or not. We have like a control trial to compare oral and topical finasteride. We found that if we pass around 6 months, the efficacy is quite nearly the same after 6 months. A little bit lower in topical, but the benefit is that if you use topical compared to oral, it lessens the DHT level. The DHT level less than oral, so the side effect may be less.
In my detailed consultations, we are just making a plan when to start with treatment. I can ask doctors from what moment can switch to dutasteride, or when to start using just the topical form right away.
This is the picture of finasteride topical. It's used with oral, with topical minoxidil and have synergistic effect, so you can mix both drugs together. And also, this is a picture compare estradiol and topical finasteride. It have positive result. And when you compare, you see oral and topical finasteride, you found that the topical is like a little bit lower efficacy, not so much compared to oral. So this is also the clinical trial to compare finasteride spray 0.25% and 1% finasteride is have nearly the same efficacy. And the side effect. Let's see about the side effect. We found that in reduction of libido in topical finasteride have much less than oral finasteride. In oral, we found about 4.8% of loss of libido and just only 0.6%. And the plasma finasteride concentration is decreased less than oral finasteride. So, in my recommendation. Now in my practice, I use the technique or protocol we call finasteride switching protocol. I usually give oral finasteride for 2 years and then to topical finasteride.
To summarize, oral finasteride is more effective. Dutasteride is even more powerful. The topical form is still lagging behind in efficacy and also depends on the specific composition. However, the effectiveness can be increased by dermapen. There will be a separate video on microneedling. For now, what you should know is that dermapen should not be used more often than once every 10, or for some, even 14 days. Homemade solutions with water and crushed finasteride tablets are not topical finasteride. I will tell you about shampoos in a separate video. But can shampoos stop baldness? Only if they are with finasteride and the right drug delivery. In the opposite case, it is, as always, just marketing. Remember that finasteride will not help everyone, and it is not always necessary to interfere with your hormonal background without understanding for what exactly and what is at stake. And my goal is to get the most effective way to a new hairstyle and self-confidence.